Get out. All right, come on in. Hi, my name is Andi. I'm going to be a nurse taking care of you today. How are you?
Good, how are you?
I'm great. Can you go ahead and verify your name and date of birth for me?
My name is Tatum Messer. My birthday is 7/28/03.
Okay, that matches your armband. So today I'm going to be doing a head-to-toe physical assessment. I'm not going to be checking your vitals since I saw that a nurse came in about 5 minutes ago and I already checked them, right?
Yep.
All right, good. So I have a couple of questions for you. Some point I'm going to be poking around on your abdomen, so you need to use the restroom before we get started. No. All right, good. All right, so are you in any kind of pain right now?
No.
All right. Do you have any allergies I should be aware of?
No.
Do you know what year it is?
2022.
All right, do you know where you're at?
My house.
Do you remember what I said we were going to be doing?
A head-to-toe physical assessment.
So, when you walked in, I saw that your gait was steady. There was no shuffling, no limping, anything like that. Your posture is erect. Your affect is calm and cooperative. You are alert and oriented times 4, person, place, time, and situation. And your speech, when you answered all the questions, was not slurred or anything like that. So I'm going to go ahead and get started. What I'm going to do is I'm going to start from basically your head and go down to your toes, and then I'm going to work out from your extremities, okay? All right, so first I'm going to just look at your face. I see that there are no scarring, lesions, bruising, edema, anything like that. Can I feel your face? All right, so your temperature is warm. Your color and texture is normal for your age and ethnicity. I don't notice any abnormalities based on your skin. I also see that your eyes and ears are symmetrical and your nose is midline. The points of your eyes do line up with the tops of your ears, which is to be expected. Alright, so first I'm going to go ahead and do an eye examination. What I'm going to do is shine a pin light into each of your eyes. Just look kind of like directly right here. And I'm just going to check your pupillary reaction, okay?
Okay.
Alright, perfect. Alright, good. So next I'm going to hold up my pen light, and all I need you to do is focus on it and watch it all the way down to your nose, okay? Alright, so pearl is present, which means that your pupils are equally round and reactive and accommodating to light and accommodation, sorry. So next what I'm going to do is I'm going to have you pull down your lower lids. Alright, so I see that your conjunctiva is pink, your sclera is white, and your corneas are clear. So what I'm going to do next, I'm going to go ahead and look at your nose. So I want you to tilt your head all the way back, and I'm just going to shine a light up there. Alright, so I don't see any signs of a deviated septum. I also don't see any excess drainage or anything like that. So if you can, go ahead and plug one of your noses and one of your nostrils and blow out air from the other. Alright, now do the other side. Alright, so you're just patting, which is good. So what I have you do is open your mouth and say ah. Alright. I see that your uvula is midline, that your oral mucosa is pink and moist, as it should be, and that your detention is intact, which just means that your teeth are there. Okay? Alright, so next I'm going to go ahead and move to your ears. Can I feel them real quick? Alright, so is there any kind of tenderness when I touch your ears? Okay, and they're not warm, they're not really hot, and they're not red, okay? And I don't see any signs of cauliflower ear in your ears either, okay? So what I'm going to do is I'm going to look inside of your ears. Normally I would have an otoscope, and I would look closer to inside of your eardrums. But since I don't, I'm just going to shine my pin light in there, okay? Alright, so I'm going to pull up and back. Alright, I don't see any redness or drainage on that side. I don't see any redness or drainage on that side either. Next, I'm going to go ahead and check your hearing. So if you can, will you plug one of your ears or cover one of your ears, and I'm going to whisper a word into this ear, and you just repeat it back to me, okay?
Ice cream.
Alright, cover the other ear.
Cookies.
Alright, perfect. So your hearing is intact. So that is everything for your face. I'm going to go ahead and move down to your neck. So just looking at your neck, I don't see any scarring, bruising, edemas, lesions, anything like that. Your color and texture is consistent with the rest of your body. Can I go ahead and feel? Alright, so your temperature is warm, which is what we want. So what I'm going to do first, I'm going to check your range of motion and strength in your neck. So what I'm going to have you do is put your chin down to your chest. Alright, now all the way back. Alright, now tilt your head to this side, put your ear to your shoulder, and do the other side. Alright, good. So your range of motion is intact. So what I'm going to do next is check your strength. So I'm going to put my hand on your cheek, and you're just going to turn like you're looking at that wall, okay? And push. Alright, good. So your range of motion and strength in your neck is intact. which is good. Next, I'm going to go ahead and palpate your carotid arteries. So what I'm going to do first is I'm just going to do one side. I need to check them bilaterally, so I will check both sides, but just one at a time, okay? So sit still and quiet. Alright, so your carotid pulse was +2 and regular bilaterally, which is what we want. So next I'm going to go ahead and listen for what we call a carotid buoy. So what I'm going to do is I'm going to use the bell stethoscope, which is just a tiny side, and I'm going to place it on to your carotid artery, and I'm going to have you hold your breath for just a second and listen for any kind of whooshing or anything like that, okay? Alright, take a deep breath in and hold it. Alright, you can breathe now. Alright, take another deep breath in and hold it. Alright, perfect. So there's no carotid buoy noted, which is what we want. I don't have anything else for your neck, so if you will, go ahead and take off your shirt if you're comfortable with that. And you just set it next to you. Alright, so first I'm just going to visually assess, and I do notice some scarring here, but I saw in your chart that it was from previous surgery. Is that correct?
Yes.
Alright, I don't see any other scarring, bruising, swelling, lesions, anything like that. Your color is consistent with the rest of your body, and so is your texture. Your warmth is good. Your temperature is good. So what I'm going to do first is I'm going to listen to your heart sounds. I'm going to listen at 5 different points, and I'm going to tell you where each one of them are and what they are first, okay?
Okay.
Alright, so I'm going to come to your right side first. I'm going to go down to your second intercostal space on your right sternal border. Then it's going to be your arterial sounds. And then I'm going to move to your left sternal border at your second intercostal space. There's going to be pulmonic. And then I'm going to move down to the third intercostal space on your left sternal border. That is going to be Erb's point. And then the fourth intercostal space on your left sternal border, and that is going to be your tricuspid valve. Then I'm going to move over here to your left mid-clavicular line at the fifth intercostal space, and that is going to be your mitral valve. And at your mitral valve, I'm going to stop for a full minute, and I'll listen to your apical pulse for an entire minute, okay? So I just need you to sit still and quiet and breathe normally. I'm also going to switch this back to the diaphragm at stethoscope. Alright, now I'm going to listen to your apical pulse for an entire minute right here. Alright, your apical pulse was 75 beats per minute, which is within the normal range. We usually want it between 60 and 100 beats per minute. That's good. I didn't hear any extra beats. I only heard the S1 and S2 beats that we normally hear. I also didn't hear any clicks or murmurs or anything like that. So next what I'm going to do is I'm going to listen to your lung sounds. So I am going to listen to about 6 points on your chest and listen to your anterior lung sounds. So all I need you to do is take a deep breath in and out every time I move my stethoscope. If I get going too fast or anything like that, and you get dizzy, just let me know and we will stop, okay?
Okay.
Alright, so deep breath in and out. Alright, so your anterior lung sounds were all good. I didn't hear any adventitious sounds like crackling, wheezing, bronchi, or friction row. They were all normal on the anterior part. So now I'm going to move to your posterior. So I just need you to stand up and turn around for me. Alright, so what I'm going to have you do is the same thing. I'm just going to have you take a deep breath in and out every time I move. But this time I'm going to listen to about 8 to 10 spots, okay?
Okay.
Alright, so deep breath in and out. Alright, so you can sit back down. Okay, so your posterior lung sounds were good as well. I didn't hear any adventitious sounds back there either. No crackling, wheezing, bronchi, or friction row. They were all good and normal anteriorly and posteriorly. I've also noticed as you've been breathing regularly that your respirations are effortless. You haven't been using any accessory muscles or anything like that. So it's all good. So now I'm going to go ahead and move on to your abdomen. So what I'm going to have you do is lay down on the table. Alright, so first, place your hands on your side. I'm just going to look and I'm not going to touch anything or listen, okay? First, I'm just going to look. Alright, so just looking, I see that your hair is evenly distributed. I see that your stomach is flat. I also don't see any distension or anything like that. I don't see any discoloration. Your color and texture is consistent with the rest of your body. There's no bruising, lesions, edema, anything like that. I do see a site right here. However, I did see in your chart that you are diabetic. Is that just what that is for?
Yes.
Alright, good. Alright, so next I'm just going to go ahead and listen. So what I'm going to do is listen into 4 different quadrants on your stomach. I'm going to listen to your lower right, your upper left, and then your lower left. I'm going to listen for your gurgling sounds. So all I need you to do is just sit still and quiet, and it'll only take a couple of seconds, okay? Alright, so I did hear intermittent gurgling sounds in all 4 quadrants, which is what we want. We usually want them between 5 and 30 per minute, which is pretty much what it was, okay? So before I palpate your stomach, I'm also going to go ahead and listen for what's called an arterial bruit. So I'm going to listen right here below your xiphoid process with the bell of my stethoscope again. I just ask you to hold your breath and sit still for a second, okay? Alright, so take a deep breath in and hold it. Alright, you can breathe normally. Alright, so there was no bruit noted. So next what I'm going to go ahead and do is I'm going to go ahead and palpate your abdomen. So I'm going to do it in the same 4 quadrants in the same order. I'm going to do it twice. So the first time I'm going to do it kind of light. You just let me know if you feel any tenderness, okay? Alright, any pain, tenderness?
No.
Alright, so I'm going to do it one more time, just a little bit deeper, okay? Alright, any pain or tenderness that time? Alright, good, perfect. So, that's everything for your abdomen. So what I'm going to go ahead and do now is I'm going to move on to your legs. I'm not going to make you take your pants off or anything. I would normally just look and make sure that your color and texture is consistent with the rest of your body, that the hair is evenly distributed, that there's no pallor or cyanosis, which is just discoloration, and there's also no lesions, scarring, bruising, or edema, okay? So what I'm gonna have you do is scoot up onto the table a little bit farther for me. You can sit up if you want to. Okay, so what I'm gonna do first is check the range of motion in your hips. So I'm just gonna rotate your hips out. So if it hurts or anything, just let me know, okay? Alright, good. And this side. Alright, good, perfect. So next I'm gonna check the range of motion in your knees. So I'm gonna have you flex and extend them. I'll show you how to do it, okay? So bend them all the way. Alright, and extend all the way out. Alright, good. Bend all the way. And extend all the way up. Alright, good. So next, if you'll scoot up just a little bit further, I'm going to check the range of motion in your ankles. So just kind of rotate your ankles for me, one at a time. Alright, good. And good. Alright, so next I'm going to go ahead and check the strength in your feet. So if you will take and press your feet against my hands like a gas pedal. Alright, perfect, good. So next I'm going to go ahead and check your capillary refill in your toes. So I'm going to squeeze your greater toes. Alright, good. And it was less than 30 seconds on each side. So next what I'm going to go ahead and do is have you sit up and sit back on the edge of the table like you were. Alright, so I'm going to check for your patellar reflex. So what I'm going to do is I'm going to tap this edge of my stethoscope just on each of your, right below your kneecaps, okay? Don't look at it because it'll make you not want to do it, okay? Good. Alright, good. Alright, so next what I'm going to go ahead and do is I'm going to look at your arms. Looking at your arms, I do see that there are some tattoos here, but I don't see any infection or anything like that. I don't see any pallor or cyanosis. I also don't see any bruising, swelling, edema, anything like that. There's no extra redness anywhere. No lesions. So next, I'm going to go ahead and check your range of motion in your shoulders, elbows, and wrists and fingers, okay? So hold both of your arms out for me. Lift them all the way up and kind of roll your shoulder. All right, now just roll your shoulder like this. All right, good. So your range of motion is intact in your shoulders. I'm going to go ahead and check your strength. So I'm going to just place my hands both right here. You're just going to lift up, okay? Perfect. So your range of motion and strength is good in your shoulders. So next, I'm going to go ahead and check your range of motion in your elbows. So hold your hand out just like this. All right, now flex like you're flexing your muscles. All right, and all the way out. All right, so now if you'll just flex right here. All right, I'm going to put my hand right here and you push against it. Good. All right, now pull against it. Good. So your range of motion and strength is good in this arm, so you can press that arm down. We'll just do this one. So extend. Right, good. So right here, press against my hand and pull against it. All right, your range of motion and strength is good in that elbow too. All right, so now we're going to go ahead and check your wrist. So hold them out just like this and do like rotate. All right, good, perfect. So next, go ahead and take your fingers and just do like this. All right, now squeeze my fingers as hard as you can. All right, so your range of motion and strength bilaterally is good in all your shoulders, your elbows, and your wrists and fingers. That's what we want, okay? All right, so what I'm going to go ahead and do next is check all of your reflexes. Or not your reflexes, sorry. I'm going to check all of your pulses. So what I'm going to do first is check your brachial pulses, which are right here. I'm going to check bilaterally. All right, so bilaterally your brachial pulses are +2 and regular. I'm going to check your radial pulses, which are right here on the outside of your wrist. All right, and they are +2 and regular. What I'm going to go ahead and do while I have your hands up here is I'm going to check for your capillary refill in your fingers. All right, now flip them over so I can see your pointer finger, sorry. All right, so your capillary refill is less than 3 bilaterally, which is what we want. So next I'm going to go ahead and check your popliteal reflex, or your popliteal pulses, sorry. All right, so they would be right here behind your kneecaps. All right, they're +2 and regular bilaterally. So next, if you will scoot back onto the table and put your feet up for me, just like this. All right, so I'm going to check 2 different pulses in your feet. I'm going to check your dorsalis pedis, which is right here on the top of your foot. Right, and it's +2 and regular bilaterally as well. All right, so now we're going to check your posterior tibial, which is right here behind your ankles. All right, it's +2 bilaterally and regular bilaterally as well. So now if you'll set your feet out flat, just lay your legs out, I'm going to check for what is called a clonus reflex. So I'm going to take your ankle and I'm going to support it right here, and I'm going to push your foot back. So just let it do what it wants to do naturally, okay? All right, good. Next side. Alright, good. So you're negative for a clonus reflex, which is what we want. Okay, and the last thing I'm going to do really quick is I'm going to check for your sensation on your extremities. So I'm going to have you just close your eyes. Alright, so just tell me which extremity I'm poking, okay?
My right leg. My left leg. My right arm. My left arm.
Alright, perfect. So your sensation is intact in all extremities. That should be everything for my head to toe assessment. Do you have any questions for me? Alright, perfect. So normally I would lower your bed all the way to the floor. I'd make sure that the bed locks are on so that way you can't go anywhere. Put your guardrails up for you. Make sure that you're safe, and then I will give you a call light. So that way if you need anything from me, you can go ahead and call me or call one of the other nurses if you need any help, okay? And I also do want to let you know that, yeah, you can go ahead and put your shirt back on. I do want to go ahead and let you know that HIPAA will be maintained after this. I'm going to go document all of my findings, my assessment findings. However, all of that information will only be shared with your healthcare team, okay?
Okay.
Alright, so as long as you don't have any questions and you're good, I'll be back in about 30 minutes to check on you after I go document, okay?
Okay.
Alright, great. Have a great day.
Thank you.